it is important to know chemotherapy side and after effects, because many of these side effects and after effects can affect people's ability to exercise, because they do tend to affect many systems that can be impacted and affected and interfere with exercise. So, and as we mentioned with radiation, chemotherapy and surgery, the effects can be short term, they could be in the coming months, or they could be very, very long term. Fatigue, menopause, particularly if there have been reproductive cancers, infertility. We'll talk a little bit more about changes to the heart. So a lot of cancer drugs, chemotherapy drugs are cardiotoxic. They can affect the lungs. So when Lance Armstrong was going through his cancer treatment, he really was a pioneer for developing chemotherapy treatments that would have less damage to his heart and his lungs. Kidney disease, because of the treatments, they can be toxic to the kidneys. Changes in hair and nails. It's interesting, people who I've known or who have had cancer and they lose their hair as a side effect of chemotherapy, interestingly, when their hair comes back, it comes back different. So it often comes back curlier, it comes back darker. So there's a real change in their hair, or it comes back totally gray. Neuropathies can happen, numbness, tingling. We'll talk about tinnitus, so ringing in the ears, weakness, cognitive problems, memory loss. In fact, they even call it chemo brain. Many of the drugs are toxic. They reduce bone density. And some of the drugs can cause secondary cancers. So they can cause cancers in additional places than where people originally had cancer. These are some of the chemo drugs that they cover in the Cancer Exercise Trainer webinar. They really go into a lot of detail on these, so I am not going to do that because they practically did an entire webinar just on a lot of these, drugs and their side effects. So if you want to get certified, you really have to know these drugs, what they do, and where they have, where there can be issues. So certain types of chemo drugs are alkylating agents. Cisplatin, platinum-based drugs, those are used in leukemias and lymphomas. So those are ones that can cause tinnitus. They also can increase secondary cancer. So that's the cancer in another site. Antimetabolites, they affect many cancers. Because cancer is rapidly dividing cells, that's why these drugs target these cells that are rapidly dividing. So unfortunately, sometimes they will affect cells that are normal but still dividing. So methotrexate is a very common chemo drug that you may hear of, and so that's going to affect the DNA and the RNA. They're used in leukemias and brain cancer. Anti-tumor antibiotics. Yes, there are very strong antibiotics that are used as chemotherapy agent. There's a class called anthracyclines, and the big one is called doxorubicin. So this is one that is cardiotoxic. So very important if someone ever took doxorubicin. The effects can also be a long time away. So if someone took docs, as they call it, in their 20s, they might develop heart problems in their 30s and 40s. So it really can happen at any time. What's very interesting about docs is that I saw a presentation at the National ACSM last year by Dr. Scott Powers, the author of the XFIZ textbook, and he is doing some research in this, and that exercise appears to lessen the effects of doxorubicin when a person is undergoing chemotherapy. So it was really pretty impressive research, and there certainly needs to be more, but there are more studies coming out about the effect of exercise to counteract the effects of doxorubicin. Certainly other drugs, mitotic inhibitors, make sense, help stop cell division. So the names do what they say they do. They're used in a variety of cancers, and those are the ones that can cause peripheral neuropathy, so numbness. And of course, corticosteroids, prednisone, leads to weight gain, type 2 diabetes, and people at risk of osteoporosis. So people could be on a whole variety of different types of drugs. Other drug therapies, hormone therapies, can be used for hormone-dependent cancers. So anti-estrogens in breast cancer, tamoxifen, women will take tamoxifen, after they've had surgery or any type of radiation. Aromatase inhibitor, so that's an enzyme inhibitor. Arimidex is for postmenopausal breast cancer. And then for men who have prostate cancer, gonadotropic releasing hormone or luteinizing releasing hormone antagonist. So this is where you're going to have to be careful with their risk of increased osteoporosis and loss of muscle mass because they have suppression of their own testosterone. Immunotherapies, Herceptin is an antibody used in a certain type of breast cancer that is called HER2 positive. Interferon is used in thalidomide. So, very dangerous drugs, very toxic drugs. And you have to remember too that even though the drugs are targeting these cancer cells, the rest of the body needs to try to remain as healthy as possible.